Hi, everybody. My name's J.O. For those who don't know, this is the beginning of the annual election period, October 15th through the December 7th. You have the right to change your Medicare Advantage plan or also your Part D plan at any point in time. The last one you select will be in effect for January 1st. For those of you who want to switch from Medicare Advantage to Medigap, it is very important to follow steps in the proper order. The first step is to first be accepted by Medigap. You may have a guaranteed issue right, something that I can point out to you if your rights to apply for Medigap and be accepted are guaranteed by federal regulation. But if not, then you will want to pass medical underwriting first. The simple reason is that when you apply for Part D, it will auto-eject whatever Medicare Advantage plan you may have had in the past. And so what I'm trying to prevent for you is that you not have additional medical coverage on top of your original Medicare, the federally issued red, white, and blue card. It's important to have the steps done in the proper order. As I've stated in the newsletter, lots of changes, as I expected. About a third of Part D, the standalone prescription plans, have now been discontinued. That said, what is also going to happen is there's going to be a $2,000 annual out-of-pocket maximum limit set for every Part D plan. For Medicare Advantage, the same can be said regarding prescription coverage for Medicare Advantage, if your plan includes prescription drug coverage, then it will also have the same $2,000 a year annual out-of-pocket maximum for prescriptions. That said, I do expect the extra benefits to decline to some degree. For Medigap, a more subtle change here, and that's the reason that we're here behind the paywall, which is that due to a clause in the Affordable Care Act, what will happen is men and women's Medigap premiums will be equivalent to each other. So identical twins, 67 years old, male and female, living in the same county, your Medigap premiums will be the same. The issue is the fact that if you're a female, your rate of increase will be higher compared to your male twin. Now, there are ways to counteract this. Please send an email. That means that if you're a married couple or if you're a female, you will definitely want to take a look at this. I don't mention these types of things for $10 a year. Definitely not. When I'm talking about differences, we're talking about multiple hundreds of dollars in a calendar year can be saved. It's something that we've been happy to do, which we have already accomplished for many. Emails to info@gh2benefits.com. Remember that once December 7th has passed, there's little that I can do in terms of your Part D or Medicare Advantage plan. All right, everyone. Thanks.